Okay, so as you can see, we've got our cardiac cycle diagram still up here. P wave, ECG on the top. We have the pressure changes going on within the aorta, the ventricle and the atria throughout the cardiac cycle, and of course the volume changes. Now let's just talk about a few interesting aspects of this that may help you in your understanding of it. The first thing, the ECG, we said that we'd start with there because of course the P wave is an indication of atrial depolarization, and that's what it is. You're recording the difference between the depolarized and unpolarized cells of the atria. But let's sort of look at it from a diagrammatic aspect. So I'll just draw the heart here. It probably doesn't come out too well in blue, so I'll do it better here in a nice way. So there's our heart. Okay, here's our two atrial chambers. Here's our septum and different ventricles and so on. We have the left ventricle with the thicker wall because it ejects more blood, the right ventricle with the thinner wall because it works less pressures. Not more blood, of course, works at more pressure. What am I talking about? So same amount of blood being ejected by these two, but the left ventricle, of course, has to work through your whole system. Greater pressure has to produce greater force. But we're not talking about that. We're talking about the P wave. Now, of course, the P wave is initiated by the cells of the sinoatrial node. So here are your cells here in your sinoatrial node. Here is your atrioventricular node, which, if you remember, is the only place where information or electrical information should travel from the atria to the ventricle. The fibrous skeleton that separates the atria and ventricle prevents electrical activity passing from atria to ventricle, except at this point here. So we know we have a specialized conducting system that sends information from the sinoatrial node to the atrioventricular node, but at the same time the stimulation or the polarization of these sinoatrial node cells, of course, will spread the polarization through the atrial muscle cells from the right onto the left atria, and so you'll get this coordinated contraction of your atria. And remember, the coordinated contraction of the atria, as shown here, produces a slight increase in the volume of blood in the ventricle. This, of course, is not important when you're at rest. However, when you exercise, the actual contraction of the atria can produce quite a large percentage of your what we call end diastolic volume, and we'll talk about that in a minute. So, but back here again, I keep on digressing. We have the depolarization of the atria, and so it's the electrical difference between the polarized cells and the not yet to be polarized cells of the atria that produce this P wave. So, of course, at the end of the P wave, all the cells of the atria have depolarized and now contracting, and as they contract, of course, they're going to eject blood into the ventricle, and you're going to also see an increase in the pressure of the atria. So please excuse my diagram's probably not the most time or well set up in time. So we can see that get polarization, contraction of the atria, and it forces the blood into the ventricle. Now there is a delay between the information reaching the AV node and then spreading down into the ventricle. And this delay forms what we call the PQ or PR interval. So the time between here and here is really caused by this delay at the atrioventricular node. And this is important because this allows time for the atria to contract and for them to the atria to eject that last amount of blood into the ventricle. So really, if we're looking at making this diagram more right, which is what we should do, really is what you see is the contraction, of course, an increase in pressure of the atria is going to occur after the period of atrial depolarization, of course. And then we'll see the increase in volume, or the slight increase in volume, occur at this point here. Okay, so we'll just make that. I'm very bad at drawing these diagrams, as you can see. So that's all set. We have the pressure increasing after the depolarization due to atrial contraction and that small ejection of extra blood in. So then the atria repolarize, so the atria is relaxing, but this repolarization occurs at this stage here. So it's obscured by the QRS spike. And the QRS spike, of course, is due to depolarization of the whole of the ventricle. So of course when the ventricle is depolarizing, it's beginning to contract, and so what happens is that's when you get this increase in pressure in the ventricle. Yeah. So of course we know that as the ventricles contract here, so it's contracting here, the pressure becomes greater than atrial pressure. We get the heart sound 1, the mitral valve shut, but not at greater than aortic pressure, so we get the period of isovolumetric contraction, no change in blood, yeah, or blood volume of the ventricle because the valves are shut. Then, of course, what will happen is that you get the opening of the aortic valve once ventricular pressure is greater than aortic. And this, of course, is due to the fact that the ventricles are contracting and forcing their blood up, coordinated fashion out of the aorta, and hence ventricular volume decreases dramatically. So what I've just got to add here, of course, is that is the period of isovolumetric, and then here is where we get the ejection. Now note that we have quite a rapid ejection at the beginning. This is because the pressure in the ventricle is greater than the pressure in the aorta, much more at the beginning, so we eject more blood out, which is important. So what happens is the blood gets ejected out into the aorta stretches because of course it's very elastic, and then during the end of, or at the end of the contraction and after the contraction's over, it slowly springs back, and this gives you a more steadier sort of pulse of blood coming out of the aorta to the rest of your system. Alright, so that's sort of what's going on there. Now, of course, eventually what will happen is you'll get repolarization, so the ventricle now is going to relax, and so when it relaxes, of course, pressure drops, shutting of valves, and we stop ejecting the blood. So hopefully by tying together what's happening here within the depolarization and the delay and so on, you can see the tying together of the ECG with the heart sounds, with the pressure changes, and with the volume changes, okay? If you guys have any questions, just get in contact with me and I'll be more than happy to answer what's going on. All right, good one.